Wow. Okay, so you sent over this big stack of research on phototherapy.
Yeah.
And I can tell you're really into this whole thing of using UV light, like UVB and UVC specifically to treat infections and skin conditions.
Yeah.
We've got excerpts here from a medical handbook,
Mm-hmm.
which dives deep into the science and the clinical applications.
Right.
So let's jump in.
It's really interesting stuff. I mean, to think that we can harness something like light,
Yeah.
for therapeutic purposes.
Yeah.
It's, well, it makes me wonder what else we could be using that we haven't even discovered yet.
Oh, absolutely.
Yeah.
It's really like going back to basics, but with this high-tech twist.
Yeah.
The handbook actually starts by talking about how phototherapy has been around for thousands of years,
Mm-hmm.
like going all the way back to using natural sunlight to treat skin problems.
Yeah.
It's fascinating how humans have always just instinctively looked to nature for solutions.
It's really that understanding of nature that led to these big breakthroughs. The research highlights the work of Niels Ryberg-Finsen
Okay.
in the early 1900s.
Early 1900s, okay.
He won a Nobel Prize
Wow.
for treating skin tuberculosis with concentrated light from a carbon arc lamp.
Interesting.
It might seem kind of straightforward now,
Yeah.
but back then it was revolutionary.
Oh, yeah. A Nobel Prize. That's a sign of some serious progress.
Right.
Using a carbon arc lamp sounds a little intense, though.
Yeah.
Were there any limitations with his method?
That's a good question. While it was groundbreaking, it did have some drawbacks.
Okay.
Carbon arc lamps emitted this broad spectrum of light.
Yeah.
Not all of it was actually beneficial,
Mm.
and they were tough to control,
Okay.
so making precise treatment really challenging.
So that was a challenge. Okay.
But his work paved the way for more focused and effective phototherapy.
So those early limitations kind of sparked further innovation.
Yeah.
Okay. And now one of those common uses of phototherapy is using UVB to treat psoriasis. Before we get into that, can you kind of give us a clear picture of what psoriasis is?
Sure. So psoriasis is an inflammatory skin disease.
Okay.
Affects about 2% of the population.
Okay.
It's caused by an overactive immune system,
Gotcha.
which triggers this rapid buildup of skin cells,
Oh, wow.
leading to these thick red patches covered with silvery white scales.
So almost like a coin-sized
Yes.
spot?
Yeah, it can be like, sometimes it can be bigger and cover large areas of the body.
And those scales are pretty distinctive.
Right.
It sounds like it would be pretty uncomfortable to deal with.
Absolutely. It can be really uncomfortable and even painful.
Oh, wow.
The rapid cell turnover disrupts the skin's natural barrier,
Okay.
leaving it vulnerable to irritation and infection.
Makes sense.
Plus, the condition is really visible, so it can have a big psychological impact.
Oh, for sure. So no easy fix then, I'm guessing.
Unfortunately not. There's no cure because of the genetic component.
Okay.
But phototherapy, specifically UVB therapy, can help manage the symptoms.
So that's where the targeted approach of UVB comes in.
Yeah.
But how exactly does shining light on the skin help with psoriasis?
Well, UVB light penetrates the skin's surface.
Okay.
And it targets the immune cells
Right.
that are overactive and causing the inflammation and rapid cell growth.
So it's kind of like a braking mechanism?
Exactly. It slows down the cell division,
Yeah.
calms the inflammation. It's
Yeah.
all about restoring that balance in the skin.
It's amazing how light can have that effect on ourselves.
Yeah.
Now, I read that there are different types of UVB therapy.
Yeah.
Broadband UVB and narrowband UVB.
Mhm.
What's the difference there?
Think of it like tuning a radio. You
Yeah.
want to hit the right frequency for the best sound.
Yeah.
Narrowband UVB, or MBUVB,
MBUVB, okay.
focuses on specific wavelengths of light
Okay.
that are really effective for treating psoriasis.
So it's more targeted.
Exactly. And that's why it's usually preferred over broadband UVB,
Gotcha.
which emits a wider range of wavelengths, some of which can be less effective or even harmful.
So it's all about finding the right wavelengths for the job.
Right. And with NBUVB, you minimize the risk of exposure to the less effective wavelengths.
Makes sense.
Hmm.
And doctors can actually personalize this UVB therapy, right?
Yes, they can determine the minimal erythema dose, or MED, for each patient.
So what is that exactly?
It's like finding that sweet spot,
Okay.
the most effective dose without causing sunburn.
Makes sense. You don't want too little because it won't work.
Right.
And you don't want too much because you risk damaging the skin.
Exactly.
So I'm guessing the MED varies from person to person.
It does. It depends on things like skin type, the severity of their psoriasis,
Yeah.
and their individual sensitivity to UV light.
Okay.
Doctors usually start with a low dose and gradually increase it,
Okay.
monitoring the patient's response to find that perfect balance.
So it's a really personalized approach.
It is.
What about for like really stubborn patches of psoriasis that just don't want to go away.
Right.
Are there other options for targeted treatment?
Yeah. There are tools like excimer lasers and lamps.
Okay.
These deliver a concentrated beam of UVB light at a very specific wavelength, 308 nanometers,
308. Okay.
to pinpoint those tricky patches.
So it's like a laser pointer,
Exactly.
zeroing in on those problem areas.
Yeah, it allows for precise treatment without affecting the surrounding skin.
So we've got a whole toolbox of UVB therapies to tackle psoriasis from all these different angles.
We do. It's really impressive how far it's come since those carbon arc lamps.
Yeah.
And the research is constantly evolving,
Right.
leading to even more targeted and effective treatment options.
And speaking of evolving research, you mentioned UVC earlier,
Yeah.
and I know that's another type of UV light being explored for its potential, particularly for infections.
Yes. UVC has been known for its germicidal properties for over a century.
Wow.
It's really effective at killing bacteria and viruses,
Mm-hmm.
even those resistant to antibiotics.
So it's like a super sanitizer
Right.
with the potential to tackle those tough drug-resistant bugs.
Yeah, it has that potential. That's a game changer, especially with the whole threat of antibiotic resistance.
For sure. But
Yeah.
before we get ahead of ourselves,
Yeah.
it's important to understand how UVC works
Okay.
and the research behind it.
All right. So let's dive into that world of UVC. How does it actually kill those microorganisms?
Well, UVC works by damaging the DNA of bacteria and viruses.
Okay.
So it stops them from replicating and spreading.
It's like hitting their control center
Yeah,
and making them unable to function.
right.
That sounds incredibly powerful.
It is.
But if it can damage the DNA of bacteria, I mean,
Yeah.
what about the impact on human cells?
That's a good point. You're right.
Yeah.
While UVC is very effective against microorganisms, it's also potent
Okay.
and needs to be used carefully.
So researchers are working on ways to deliver it in a targeted way.
Yeah, to minimize any potential harm to healthy tissue.
That makes sense.
Mm-hmm.
It's all about that balance between effectiveness and safety.
Great.
So before we get into the specifics of the UVC research, I think it's time for a quick break.
Fine.
We'll be back in a moment to explore the exciting possibilities and challenges of UVC therapy.
Sounds good.
Great. Okay, so we're back. And we're talking about the potential of UVC to fight infections.
Right. There's so much to talk about with UVC.
Yeah.
I mean, the research is just full of potential. Scientists are exploring all kinds of applications.
Okay.
One area that's really exciting is wound healing.
That makes sense. Infections can make healing so much harder.
Oh, absolutely.
So what kinds of wounds are we talking about here?
Well, one study that comes to mind focused on chronic ulcers infected with MRSA.
MRSA. Okay, so those are already tough to heal.
Exactly. They're notoriously difficult.
Yeah.
Often need long courses of antibiotics.
Right. And then you've got the whole antibiotic resistance issue on top of that.
Exactly. And antibiotics can have side effects too.
Of course. So how did UVC do in that setting?
The results were pretty amazing.
Okay.
Just one UVC treatment significantly reduced the bacteria in the wounds, and it actually helped them heal faster.
So it's doing double duty.
Yeah, and get this, 2 of the 3 patients in the study,
Yeah.
their wounds completely closed up in a week.
A week.
That's incredible.
It's really remarkable.
Yeah, it sounds like UVC could be a game changer for people struggling with those tough infections.
It really could be.
What about other infections, though?
Yeah.
Like fungal infections? Is there research on that?
Oh, yeah. Absolutely.
Yeah.
Researchers are looking into UVC for a whole range of infections.
Okay.
There's a study that looked at UVC for Candida albicans infections
Candida albicans.
in mice with third-degree burns.
Oh, wow. So that's a serious infection.
It is. Candida is a fungus
Right.
that can cause really bad infections,
Yeah.
especially in people with weakened immune systems.
And burns create that perfect entry point for infection.
They do. It's a big concern for burn patients.
So what did they find with the UVC?
UVC was really good at reducing the fungus in the burns.
Okay.
Actually, it worked even better than a standard antifungal treatment,
So UVC could be an alternative to those medications. Yeah.
or even better.
That's a big deal, especially with all the talk about drug resistance.
It really is.
Yeah.
But we do need to remember this is still early research.
Right.
More studies are needed to be sure.
Yeah. We need to be cautious.
Absolutely.
Okay. So we talked about safety with UVC.
Hmm.
Can you tell us more about the research on how to deliver it safely?
Yeah. A lot of the research is focused on the selectivity of UVC,
Selective.
meaning how to make it kill the microorganisms, but not human cells.
Okay. So there must be some difference between the two that allows for that.
Right.
What are the researchers finding?
Well, one thing is the size and structure.
Okay.
Bacteria and viruses are much smaller
Yeah.
and simpler than human cells,
Right.
so they're more susceptible to DNA damage from UVC.
Kind of like hitting a smaller target.
Yeah, exactly.
Yeah.
Yeah.
That makes sense. Are there any other factors?
Research also suggests that human cells have better DNA repair mechanisms.
So they can bounce back better.
Yeah. So even though both types of cells can be affected,
Human cells seem to be more resilient.
interesting.
Oh.
But we still need to be careful with how we deliver it.
Oh, absolutely. That's where these targeted delivery methods come in.
Okay.
The research mentions this technique called pulsed jet lavage.
Pulsed jet lavage.
It's used with UVC.
What is that exactly?
From what I understand, it uses a high-pressure stream of fluid to clean wounds.
So like a power washer for wounds?
Yeah, something like that.
And how does that relate to UVC?
It's all about creating a clear path for the UVC light.
Okay.
One of the challenges is that things like blood and other stuff in the wound
Yeah.
can block the UVC.
So we can't reach the bacteria.
Right. It's like trying to shine a light through a thick fog.
You got to clear the fog first.
Exactly. And
Yeah.
that's what pulsed jet lavage does.
Okay.
Cleans the wound so the UVC can get in deeper.
Smart. So it's cleanse and then treat.
Exactly.
Researchers are really thinking this through.
They are always trying to improve things.
And we got to talk about the elephant in the room. Resistance. Could microorganisms become resistant to UVC?
That's a great question, and it's a valid concern.
Yeah, we've seen it with antibiotics.
Right.
It's a huge problem.
It is. But so far, there haven't been any reports of widespread UVC resistance.
Okay, that's good.
Yeah. But researchers are definitely keeping an eye on it.
They need to be proactive.
They do. We need to figure out what could cause resistance.
And how to stop it.
Exactly.
So what are some of the things that could lead to UVC resistance?
Well, one possibility is that microorganisms with certain mutations
Okay.
might be able to survive UVC.
So they're the strong ones.
Yeah. And they could pass those resistant genes on.
So it keeps spreading.
Right. Kind of like natural selection.
Survival of the fittest, but in the microbial world.
Exactly.
What else?
Another possibility is that using low doses of UVC over and over
Okay.
could accidentally make the resistant strain stronger.
Like what happens with antibiotics.
Exactly.
Okay.
So finding that right dose is key.
And using it carefully. What about strategies to prevent resistance? What are the researchers working on?
Well, one idea is to combine UVC with other things,
Okay.
like photosensitizers or even antibiotics.
So hitting them with everything we've got.
Yeah, attacking from all sides.
I like that. What else?
Another promising strategy is to use pulsed UVC
Pulsed UVC.
instead of continuous exposure.
Okay.
So short bursts of UVC followed by darkness.
Interesting. So it's not just about the amount of UVC, but how it's delivered.
Right. It seems like the timing matters too.
Makes sense. It's all very nuanced.
It is. But the initial research is encouraging.
Yeah,
It shows that scientists are taking the risk of resistance seriously.
that's good to hear.
Yeah.
So it's not just about a quick fix.
No, it's
Yes.
about finding solutions that work long term.
Exactly. Okay. So UVC has a lot of potential for infections, but we can't forget about UVB for skin conditions.
You're right. We've talked a lot about UVC,
Yeah.
but it's time to get back to UVB
Okay.
and really dive into its applications and long-term effects.
Sounds good. Let's do it. Okay, so we're back, and we've been talking all about phototherapy.
Yeah.
Exploring UVC for infections,
Right.
UVB for those skin conditions,
Yeah.
like psoriasis.
Right. UVB therapy has really been a game changer for people with psoriasis.
Yeah.
It's a non-invasive approach that can really improve their lives.
Mm-hmm. And the research keeps advancing.
Yeah.
We're learning more about the long-term effects and how it can be used for other conditions too.
Right.
So speaking of long-term effects, one of the studies you mentioned looked at patients who used UVB therapy for psoriasis over several years. What did that tell us about the long-term safety?
That's a really important question.
Yeah.
I mean, with UV exposure, there's always that worry about skin cancer,
Yeah.
right? But this study actually didn't find any increase in skin cancers
Oh,
in those who were treated with UVB.
that's good to hear.
Yeah, it shows that when UVB therapy is used correctly,
Yeah.
the risks are pretty minimal.
So it's all about using it appropriately and under the guidance of a doctor.
Exactly. You need a qualified dermatologist to determine the right dose
Mm-hmm.
and monitor for any side effects.
Personalized care is so important.
It is.
Now, I noticed that the research said there's no reason why pregnant women can't use UVB therapy.
Right.
Can you talk about that a bit more?
Yeah, pregnancy can complicate treating any condition.
Of course.
You have to think about the safety of both the mother and the baby.
Right.
The fact that UVB can be used during pregnancy
Yeah.
shows that it's pretty safe
Yeah.
when used properly. Of course, you always have to talk to your doctor,
Right.
weigh the benefits and risks.
So it's all about those conversations with your doctor to make the right decision.
Exactly.
And it's good to know that UVB therapy can be an option for pregnant women who need it.
It is.
And UVB is being used for more than just psoriasis.
Yeah, that's right.
It's showing promise for other skin conditions, too.
Like what?
Well, the research mentioned atopic dermatitis.
Okay, eczema.
Yes, and vitiligo.
And even some types of skin cancer.
Right. It's pretty versatile.
Yeah. Can you give us some examples of how it's used for these other conditions?
Sure. So with atopic dermatitis,
Yeah.
UVB can help reduce the itching and inflammation
Okay.
and make the condition less severe overall.
Mhm.
It's often combined with other treatments like topical corticosteroids.
Okay. So it's part of a bigger picture.
It is.
What about vitiligo?
So vitiligo causes those patches of skin that lose their color.
Right.
It can be really tough for people,
Yeah,
both physically and emotionally.
I bet.
UVB can actually stimulate melanin production,
Melanin, okay.
which is the pigment that gives skin its color.
Right.
And in some cases, it can actually restore some of that pigment.
So it's like using light to bring back the color to the skin.
Exactly. It can really improve the appearance of those areas.
It's amazing how our bodies respond to light in these different ways.
It is.
And you said UVB can also be used for some types of skin cancer.
That's right. It can treat cutaneous T-cell lymphoma,
Okay.
which is a cancer that affects the skin. It's usually used along with other therapies like chemotherapy or radiation.
So it's really a multi-pronged approach.
It is.
It's incredible that one type of light therapy can do so much,
Yeah,
from psoriasis and eczema to even cancer.
right.
It really shows the power of light
It does.
and its potential to heal.
Absolutely. And as the research continues, I'm
Mhm.
sure we'll find even more ways to use it.
So we've come to the end of our deep dive into phototherapy.
Yeah,
We've covered a lot of ground,
we have.
from the history of using sunlight to these modern UVB and UVC therapies.
It's been quite a journey.
It has. We've explored the science behind it all
Yeah.
and the research that's pushing the boundaries.
It's been great exploring this with you.
Yeah. It really is amazing how light can interact with our bodies in all these different ways.
It is.
From affecting the immune system to influencing cell growth to even repairing DNA.
It's remarkable.
And what really stands out to me is how precise these therapies have become,
Yeah.
using specific wavelengths of light and developing these sophisticated delivery methods.
It's all about finding the right treatment for each person.
Exactly. It's personalized medicine.
It is.
And it's about patients and doctors working together to make informed decisions. So as we wrap up this deep dive, I want to encourage our listeners to think about what they've learned.
Yeah.
What really resonated with you?
What new questions do you have?
What new things do you want to explore?
The pursuit of knowledge never ends.
And this deep dive is just the beginning.
It is. Keep exploring and keep asking questions.
Find those moments that light up the world around you.